Hi, I'm Radhia Gleis. If you followed me in any of my classes or videos, it all comes down to this: detox. I've been called the detox queen of Austin. As I mentioned in my lectures on detoxification, toxicity is a much greater concern in the 21st century than ever before. An EPA study showed a grand total of 5,700,000,000 pounds of chemical pollutants were released into the environment we eat, breathe, and live in just 1 year. Since 1950, at least 70,000 new chemical compounds have been invented and dispersed into our environment. Only a fraction of these have been tested for human toxicity. We are, by default, conducting a massive clinical toxicology trial, and our children and their children are the experimental animals. So let's look at the pollutants in our environment. Polluted air from factories, auto exhaust, solvents, paints, cleaning products, heavy metals, pesticides, herbicides, insecticides, radiation, inhalations. Examples of lifestyle toxins: nicotine, alcohol, caffeine, recreational prescription drugs, and OTC drugs. In dietary choices: fast food, fried and refined foods, high sugar foods, artificial food additives, colors, preservatives, meats that contain nitrites and hormones and antibiotics. Even types of internal toxins: bacterial, yeast, fungal overgrowth, byproducts of metabolic reactions such as carbon dioxide, ammonia, and hormones such as cortisol. Undigested food and even stress, anger, and resentment can create toxic byproducts. Patients develop symptoms different from underlying cause or true cause because toxins get built up in various tissues like bone and muscle and are not eliminated. Even if you were exposed to a toxin years ago, like lead, for example, it can store in bone tissue indefinitely unless removed. Generally, these toxins are fat-soluble, and toxemia occurs because liver is compromised in clearing toxins. This occurs because of inadequate nutrition, lifestyle factors, toxin overload, genetic factors, medication, and certain diseases. Excess of toxins pouring into the body, digestive system disorders that contribute to increasing levels of incoming toxins, such as constipation, chronic diarrhea, food allergies, irritable bowel disease, malabsorption syndrome, lack of digestive enzymes, or even stomach acid. So let's talk about the liver. The role of the liver is to filter blood, store glucose for energy, break down steroid hormones, produce and secrete bile, but it's the primary organ of detoxification in the body. The liver eliminates toxins through a two-step enzymatic process. We call it Phase 1 and Phase 2 liver detoxification. Phase 1 is known as the cytochrome P450. This is a series of enzymes that chemically change fat-soluble toxins into a more toxic substance called an intermediary metabolite. Hence the need for Phase 2. Phase 2 is the conjugation of specific molecules onto the intermediary metabolite, which in essence converts those metabolites into water solubles so that they can be excreted out of the body. Some of the signs of liver toxicity are nausea, headache, sore throat, immune weakness, dizziness, indigestion, tight and stiff neck, environmental sensitivities, mood changes, sleep and sleepiness, itchy nose, nervousness, skin rashes, cough, frequent colds, hives, wheezing, constipation, diarrhea, runny nose, acne or brown age liver spots, body odor, pain and aches in joints and lower back, pain and aches in muscles, and even poor memory. So here's the good news. I've decided to offer a very effective 7-day Phase 1, Phase 2 liver detoxification protocol. And as a bonus, I've recorded an extensive video with everything you want to know about detoxification to assist you in this process. Click on the link to my left, and it'll take you to an information page that provides you with the details and benefit you can expect. Click on the link, and it'll take you to an information page that provides the details and benefits you can expect.